Yes, the Quantum Entwinement Subspace Prayer Program. And we're going to be teaching you today about the introduction to the Telemed program and how to understand the basic ideas of our medicine dealing first with stress. Stress is the medical concern. Now, we're going to be reviewing the basic ideas of stress as a medicine. But way back, there was the ICD code, the International Classification of Disease Code for Stress. Then it changed to 308.9. Now, here it is, 2020, and the new number is Z73.3. This is stress needed to get insurance payment. Now, we're going to be talking about medicine, a whole new idea of medicine, and how stress is the medical concern.
Hans Selye was a Hungarian, and he came up with the idea of stress and the pathway of stress as towards disease. He said that there was ease of flow, and that is health. Along comes something that helps block this flow or overstimulate the flow, and this sets up dis-ease, where there's too much or too little. We now take a look at the ideas, and as these type of stressors come in, these different things that come into the body, these different stressors, and let's take a look at them. And the idea of the stressors are, number one, just simple stress. The idea of stress at work, stress from the family, and pressure, and job stress, and school stress, desires to perform, desires to conform, desires to not to conform. All of these things put stress on us. And everybody has a different level of stress that they're comfortable with. And that doesn't change too much through life. But there's much more to life than just the simple idea of stress. There's more. There's the idea of a lack of awareness or education. If you do not know that white sugar is bad for you, if you don't have that education, then it's going to be a problem. If you do not know that having coffee with a meal is harmful to your pancreas and harmful to digestion, then you won't understand. So you have to become educated, and you have to become aware of different things. If you think that it's summer and you dress for summer, but actually it's fall or even winter, if you're not aware of the seasons, this type of condition will create problems for you. You must become aware of your body. If you're eating and your body's had enough, you have to be aware of the body saying, I've had enough, rather than the mind saying, wait a minute, I paid $24.95 for this, I'm going to keep eating. You have to be aware of the body. We have to have awareness education. We have to learn ideas of the mental factors of greed and anger, delusion, worry, and fear, and all these other things, and how they strike us and hurt us if we hold on to them too much. These different energies of the mental factors touch us, but we shouldn't cling to them. It's clinging to them that create the disease. It's okay to mourn. It's okay to be fearful. It's okay to be greedy, but not when you hold on to it. It's the stickiness of some of these emotions that create disease. Allergy has a mental factor, that when we were first exposed to something, if we're under stress, under the idea that we might possibly die, then our body will make more antibodies to something. So we have to understand these different types of things. We have to understand the ideas of heredity. We can have inborn tendencies to disease, and etc. All of these, what I've just brought here on the list so far, are the internal causes. Now let's look at the external causes of disease, the external stressors. Trauma. You could fall. You could be hit by a piece of small lead called a bullet. You could twist an ankle. Many different things that can create problems in our lives. Trauma. Toxicity. We live in a very toxic world, and toxicity can create health problems, create disease. Pathogens, microorganisms, worms, virus, bacteria, etc., create disease. Deficiency or excess of nutrients, and you can get just as sick from too much of a nutrient as you can from too little of a nutrient. We have to have a balance of these things. All of these make up an idea, including with perverse energy, the idea of too much heat, too much cold, too much wind, too much dryness, too much radiation, too much humidity, all these other things that create perverse energies. Ionizing radiation, X-rays, cosmic rays, gamma rays. These things can all create disease as well. All together now, these make up the stressors. These stressors come, and when they come, they produce an alarm reaction, Xiaoye said. The alarm reaction is like the itch, the cough, the pain. We get an alarm reaction. This is the symptom. If we do not deal with the stressor will go deeper and deeper and deeper, and eventually the body will find a way to adapt, go into the second stage and adapt to the stressor. Thereby the symptom will go away. The itch might go away, the pain, the cough, the runny eyes. These things might go away because you have adapted to the continued stressor. The disease is going deeper, but the symptom goes away, and the most critical statement in all of our healthcare: being symptom-free is not an indicator of health. We must embrace that and recognize that as well. The stressor can go deeper and deeper, and after the adaptation stage and go into the exhaustion stage, where organs start to give out, organ systems give out, cells give out, organ systems, and finally the organism. And if continued, the stressor continues, it can go into death. Before it goes, it can go into functional disturbance, where the function of an organ is disturbed, and later it can go into an organic, where not just the function, but the actual organic nature of the organ. The organ can hypertrophy and swell, or atrophy and get smaller. And thereby, we now see the different ideas of disease. In order to develop the way of handling this disease through our natural methods, we first recognized reduce all of the causes, and I say causes plural, all the causes of disease. It is rare that there is a single cause. There usually is a single thing that might be the start of all the other problems. But basically, if we look at all the causes, we get a better idea. We then want to repair the organs that have been damaged. The idea is that the cause is like a nail in the tire, but after we take out the nail in the tire is still flat. We have to do something to help repair the organ that has been affected by the cause, the stressor. To do this, we have to be able to use the Sarcode type therapies and developing and lifestyle and etc., good nutrition and all these things to help repair the organs that have been problems. Then we need to unblock the blockages to flow. The idea of dis-ease is dis-ease of flow. And we want to be able to work with the acupuncture, the chiropractic, and all the other different sciences that are balancing the flow of energy. Next, we want to treat the symptoms. Yes, we need to treat the symptoms, but we want to treat the symptoms naturally and not synthetically. The pharmaceutical people have developed synthetics, but we now know that a synthetic anything is an insult to the body. We do not want to insult the body unless we absolutely have to. Once a patient has been given a synthetic drug or any type of drug from his medical doctor, please do not interfere with that sacred relationship. You might be able to help talk to the patient, but it's between the patient and the doctor as to what they do with that relationship of whether they're going to take that prescription or not. The doctor and the patient should look at this. You might be able to offer advice and say, maybe let's try something natural, but you need to do that with the doctor, because this is very critical, to be able to work with the medical system, not against it. As I've told you in many of the other interview processes, we always want to have a referral. We want to refer our patient to the medical doctor. It's the medical doctor's job to do the diagnosis.
You see, we really don't need to diagnose. Yes, it can help, but we need to leave that diagnosis to the doctors who are licensed to do it. As a biofeedback person, you're here to help with their lifestyle, help with their stress. Leave the diagnosis to the doctors. Let them do the guessing.
If we look at House, we're going to see how they struggle to do diagnosis episode to episode to episode. That's how they work. And you can see that with virtually every patient that they do see, they always get the diagnosis wrong.
Mebendazole can cause adverse effects, but nothing like this.
He's been off them since yesterday anyway.
Long passes, wild guesses, anything.
Hypopituitarism could cause multi-organ failure.
His thyroid hormone wasn't completely normal.
Those threadworms, why would his body have gone to hell just hours after they were gone?
The worms weren't hurting him, they were helping him. He has extra-intestinal Crohn's. He got it from being raised in too clean, too overprotective of an environment.
It's the hygiene hypothesis, why there's so much autoimmune disease in the developed world and almost none in the developing world.
The worms were keeping the Crohn's in check, teaching his immune system what it should have learned from eating dirt growing up.
Once you killed them, it started killing him.
So his life of filth wasn't the problem. The clean living was. Let's start him on methylprednisolone.
And some helmets.
Worms. Cool, huh?
Yes, this is the best way to strengthen your child's immune system. This is the best way to really get the immunization. This really is the best way to start to immunize your child. Louis Pasteur was not a medical doctor, he was a microbiologist, and he was the first. He started to really discover that there was bugs, and then they get into germ theory. But on his deathbed, he realized it's the immune system that's more important than the germ. We can deal with this. Now let's learn about how we deal, and we do not diagnose, and let's learn why.
Ready to save some lives?
Killing me.
We spent a week doing top of head in anatomy. I know just where it is.
Ow! That is not the top of my head.
Yeah, close enough for clinic. Your sinuses are clogged. Judging by the scratches on your hands, I'm guessing a new cat.
Yeah, it was my mother's. She's dead.
Did you keep a dead cat?
No, my mother's dead.
Oh. Poor cat. You're allergic. We can control it with antihistamine. 1 pill a day.
Pills?
You don't like to swallow. Not surprised. Forget the pills. I'll give you a nasal spray.
Steroids? Is there something else you can give me?
Well, if you live by the river, I've got a bag.
Wait, you thought I wouldn't agree with him? Ever?
Well, you didn't agree with him. That's why he dumped you. Oh, sorry. It was mutual.
We're cool, okay? Nobody's angry, nobody's hurt.
Sounds passionate.
TTP makes sense to me.
Not to me. What if you had a history of...
One big happy family. TTP it is. Confirmed with blood smear and Adams TS13 antibodies.
I look like an idiot?
No. Why don't you show me how your inhaler works? You're stupid.
Well, I'm rubber, and you're glue.
He's not pedestrian. He's stupid. At least stupider than he should be. He's a DXM junkie.
Dextromethorphan, as in cough syrup?
Wasn't taking it for his cough.
Why are you giving Adler steroids?
She's my patient. That's what you do with patients. You give them medicine.
You don't prescribe medicine based on guesses. At least we don't since Tuskegee and Mengele.
You're comparing me to a Nazi? Nice.
Brandon's not ready for surgery.
Okay, well, let's leave it a couple of weeks. He should be feeling better by then. Oh, wait. Which way does time go?
The man's in a coma.
He didn't mind. I asked.
You're getting crumbs all over him.
Your girlfriend called the clinic 15 times looking for you today.
Huh. Lot to discuss. China patterns.
House. She's a stalker.
Right. Couldn't be that she finds me interesting, attractive. Has to be that she's insane.
She's called you 15 times. Your mother's not that interested in you.
Well, maybe I'd be better adjusted if she was.
It's usually worst in the morning, especially if I've slept on my arm. If I sleep on my back or with my arms out, I'm usually okay.
So your arm only hurts after you lie on top of it all night.
Yeah.
Well, have you thought about, I don't know, not doing that? I'm only gonna take little tiny pieces.
Till what?
Till I find the problem.
Or you kill him.
Nope, I'll keep going even if I kill him.
Got it.
Start counting. How many?
26.
Okay, either you suck at math or you're gonna die in 2 seconds. You suck at math.
What flavored dwarfs are you guys?
My daughter and I both have cartilage hair hypoplasia. Think you can make a pun out of that?
Yes, but I don't want to be insensitive. She's got a bit of a short fuse, isn't she?
Some people bottle up their feelings, have them come out as physical pain. Healthy human beings express feelings such as affection by giving gifts.
Gifts express guilt. The more expensive the expression, the deeper the guilt. That's a $12 box. Either you haven't slept with her yet, or she wasn't that good.
His fingers are even darker, his temperature's 102 and spiking, and the x-ray now shows lung infiltrates.
Well, the good news is you won't be bitching about losing his hand if he can't breathe.
How would you describe my leadership skills?
Non-existent. Otherwise excellent.
There's more to being a leader than being a jerk.
The world will never know.
We loaded him full of prednisone to try to fix the liver.
Good news is he's running out of organs to fail. Oh, almost forgot. I need to give a 16-year-old magic mushrooms to treat a cluster headache. Is that cool?
No problem. I was being sarcastic.
Wouldn't look that way in the court transcript.
Assume you considered the father and ruled him out.
What's that saying? When you assume, you become a pain in the ass to me.
Why should I argue? You just overruled me.
Enough! Get a pony or a watermelon farm.
House. Thank you so much. I gotta get you a gift or something.
Sometimes the best gift is the gift of never seeing you again.
Okay, all right.
You must be Dr. House.
You must be full of baloney. A lot of it.
Right, fat joke. Always fun. Only people you can still make fun of.
And Christians. Oh, and black people.
Thank you very much. This guy's been working for me for a long time, and
I get bonus points if I act like I care.
Merry Christmas.
And a happy go to hell.
If she's never kissed a boy, it's a fair bet she's never had sex.
Tell that to all the hookers who won't kiss me on the mouth.
Arrogant enough to think that of the 50 billion galaxies, 100 billion stars per galaxy, and 10 million billion planets in the universe, that we're the only ones with life.
No. But I'm guessing we're the only ones who like shoving things through our back doors.
If Chase screwed up so badly, why didn't you fire him?
He has great hair.
What are you hiding?
I'm gay. Oh, that's not what you meant. It does explain a lot, though. No girlfriend, always with Wilson. Obsession with sneakers. I just admitted a cartilage hair hypoplasia dwarf, 15 years old.
what are you gonna do?
I thought I'd get your theories, mock them, then embrace my own. The usual.
Are you being intentionally dense?
Huh? Oxygen saturation is 94%. Check her heart.
Her oxygen saturation is normal.
It's off by 1 percentage point.
It's within range. It's normal.
If her DNA was off by 1 percentage point, she'd be a dolphin.
What is this?
He's not a what, he's a who. They even have the right to vote now.
He swallowed a magnet. We gotta cut it out.
How old are you?
8.
And he swallowed something stuck to a fridge. Darwin says let him die.
I've got the plague.
Don't worry, it's treatable. Being a bitch, though. Nothing we can do about that.
You've got rectal bleeding.
What, all of you? Excuse me.
You stash your drugs in a lupus textbook.
It's never lupus. I don't think this is lupus. So, it's infection, lupus, drugs, or cancer. No. I think lupus is way more likely.
Treat him for lupus.
That will get you fired.
You really think House is losing it?
Yeah.
But it's not lupus.
ANA is negative for lupus. Again.
It could be an autoimmune disease. Lupus, Behçet's.
ANA for lupus, also negative. Lupus could cause...
No. Lupus progresses slower. There'd be joint pain.
So it's not a typical case.
We should get an A&A.
It's not lupus. Has he responded to the latest lupus treatment?
He's only been on it for a few hours.
He hasn't responded because it's not lupus.
The IVIG made him worse. O2 sats plummeted.
So we know it's not lupus. What else could it be?
Stool sample to check for parasites, blood culture to rule out infection, and ANA for lupus.
Autoimmune, it's better than cancer. Lupus loves kidneys. Usually attacks them first. Kidneys are fine, right?
Yeah.
Vision issues plus screwy heart equals some type of autoimmune.
Lupus and Kawasaki's are the most common in a 6-year-old.
Yeah. Tough to find a 6-year-old who doesn't have lupus.
Okay, it's affecting the larger blood vessels. It's gotta be giant cell arteritis. I'll start on steroids. It's affecting the smaller blood vessels. Gotta be lupus vasculitis. I'll start on steroids. It's affecting...
Yeah, got it.
Lupus and Behçet's are our best bet. An ANA and a pathogen test.
Or it could be infection.
My memory is not what it used to be, but didn't we just rule that out 8 seconds ago? Parasites or fungus is possible.
Or maybe lupus. Grandma has lupus.
Okay, autoimmune. I'll run a lupus panel.
That's even slower than MS. It's lupus.
I'm with the little man on this one. It's attacking the body and the brain. Classic autoimmune.
Flirt all you want, but I should warn you, Shixes are for practice.
Lupus this aggressive wouldn't spare her kidneys.
Positive, it's lupus.
Weakly, not lupus. It's MS.
We obviously don't know what it is. Treat for both.
No, I gave in on the test. We're not treating her for two completely separate diseases because you think lupus will win you a prize.
Still think it's lupus?
Yeah.
Could be lupus. That's what we figured. Then why are you here?
Could be splenic sequestration, tuberculosis.
Gaucher disease, TTP.
Hemolytic uremic syndrome, sepsis, lupus.
Listing all the possible causes is only impressive if you can do it reverse alphabetically. Wilson found signs of inflammation in your biopsy. That plus the 2 failing kidneys points to autoimmune disease, probably SLE or vasculitis. Treatment for both is prednisone. Start with 100 milligrams.
Autoimmune's just your latest theory. Like cancer before that and a kidney stone before.
Take the prednisone. You'll get better. That'll be your confirmation.
Yeah, I trusted you.
You always trust me. It's a big mistake. Lupus is a bad diagnosis.
It's the best diagnosis we've got.
That doesn't make it good.
No, just makes it this kid's only chance to live.
Actually, we've been trying to ignore that part of the whiteboard.
I wrote it in black. I'm always serious when I use black. Lupus would explain...
Maybe she didn't change.
Are you agreeing with me or are you making a point?
I'm making a point.
It's gonna take longer.
How do we know that the real Roz isn't who she is now and who she was then? Can't we say that her previous life was true without making her present one a fraud?
The life is messy argument. Nice. Explains everything without explaining anything. If it's lupus, there's a heart problem we don't know about yet. Run her through a stress test. If she has a heart attack, I'm right.
I don't think it's hepatitis. I think your son has lupus.
Heart's strong enough to prove you wrong about the change in mental status.
Only proves this isn't lupus.
They told me I have an autoimmune disease, like lupus or sarcoidosis.
That's what we're here to find out.
Lupus.
Gee, thanks for coming in.
We got a referral from...
Excuse me. You stash your drugs in a lupus textbook.
It's never lupus.
Any relatives ever been diagnosed with lupus?
I don't even know what that is.
We can test for the antibodies. 95% of patients with lupus have positive ANA.
Not cloudy. Negative.
It can happen in lupus. Increased platelet count could cause blood clots.
ANA was negative. It's not lupus.
This is true.
Hallucinations are a symptom of psychosis, which is the 4th diagnostic criteria. It's official. This is lupus.
Who's Jules? Any mention of her in the medical history?
It doesn't matter what he's hallucinating about. It matters why. It's lupus.
There's no need to get snippy. Sore throat? Oh, it's not lupus.
Phospholipid antibodies are negative, so no lupus. Same for Church-Strauss.
Autoimmune diseases can make antibodies go haywire, but still...
It's happened. Apparently it's happened again. I finally have a case of lupus.